think about the healthcare problems of homeless people, most of them are the common things that we see every day. Things like heart disease, emphysema from smoking too much. The difference is that for most homeless people, doing preventive care is virtually impossible because you're struggling to get your bed for that night or find a meal, and they just have to survive. So what we were seeing when we went out and started doing clinics in the shelters were these very common illnesses neglected for years, which I hadn't seen much of in the hospital. The social circumstances of being homeless made it impossible to use the tools I was used to. So we had to get really creative and learn new ways around standard things that we had left for. Street medicine is an interesting concept all in itself. We realize that they're a very fascinating but very, very vulnerable population, and they live right in the shadows of our big institution, but they're dying in numbers at very, very young ages. So our whole attempt is to figure out how can we bring primary and preventive care out to the streets. It begins with winning people's trust. Once we've won their trust, we can sort of ease them into trying to take some medications. We actually made a commitment to continue to follow folks once they get into housing, and we couldn't wait for them to come to us. We had to figure out how we could get to them. So half of our street work now, almost ironically, is visiting people in their homes.
Our patients want for the exact same things in life that you and I want for. They want to be loved, cared about, they want to give back. They're incredibly grateful. In order to provide good quality care, there are lots of ways that you need to improvise. You don't have everything that you would have in a hospital right at your beck and call. A very simple thing, being able to wash your hands. You don't often have a sink right beside you, so you'd, of course, know that you'd need to carry antiseptic lotion with you. I used to do a lot of work with the pregnant women and doing pregnancy tests in McDonald's bathroom. If people need medications that need to be refrigerated, being able to find a regimen that will work for them. You have to make do with what you had.
Improvising with people on the street happens all the time. Sometimes I almost forget that that's what we're doing. We have this patient who is a diabetic and he doesn't like to carry the needles on the street, which is understandable. Those get stolen a lot from a lot of the diabetic patients. We've done silly things like, well, I'll prescribe one today and I'll prescribe one tomorrow. If that helps you to go to the pharmacy and get it like that, we deliver healthcare to them in the best way possible and try to work with them and meet them where they are.
If you go out and try hard to take care of people living in really tough socioeconomic situations, you start to see the weaknesses in our mainstream system much quicker than you would see them if I had been just doing clinics here at MGH. These are folks who have lived through things that would break you or me. Instead of me thinking of them as just they haven't made it, in fact, they've dealt with it really, really well, and they've done the best they could. As we evolve this and as time goes on, we'll start to see those crude mortality rates, which I consider a public health emergency, start to see them go down, and people will start to live better lives and healthier lives.